Good day, students. This is Dr. Raskob speaking to you from the Hudson College of Public Health. And here we are going to discuss today health reform in the context of the US 2020 election. Now, the starting point, of course, is to just review and remind ourselves about the key features of the Affordable Care Act, because it's this policy that is creating considerable policy debate as well as partisan politics, with the Trump administration working to roll back or undo many of these provisions because President Trump campaigned on the concept of repeal and replace the Affordable Care Act. So just remember the critical anchors that were in the Affordable Care Act: eliminating denial of coverage due to pre-existing conditions, the individual mandate that everyone buy insurance, the employer mandate, the ability of young people to stay on their parents' plan until age 26, and then the expansion of Medicaid through the states using a enhanced or expanded eligibility up to 138% of the federal poverty level as a way of broadening access to health care and health insurance for very low income individuals. The Affordable Care Act also required essential health benefits listed here to ensure that whatever plans were being provided and sold to individuals, that these plans would have appropriate services. It was felt that it's not fair to have someone paying premiums and having a deductible over the course of the year, and then having the plan cover hardly any critical needs. And so these benefits were defined as essential and required to be covered by plans. Now, at the end of 2016, the uninsured rate in the United States was the lowest it had been in almost in history, down under 10%, just at around 9%. However, by 2018, due to efforts of the Trump administration, and of course in some states which did not expand Medicaid, which are listed up in the right-hand corner, we saw varying degrees of the percentage of the population without health insurance across different states. And so here you see the darker colors are those states with higher uninsured rates of 12% or more, of which Oklahoma is one. And you see most of the states with relatively high uninsured rates, either 12% or more or above 9%, are those states that did not expand Medicaid. Now, the uninsured rate for working age adults between 18 to 64 who is living at or below 138% of poverty level is shown in this slide for every county in the United States. And here we see in the darker blue areas and the darker green are those areas with very high rates of uninsurance. And here you see, for example, in Texas, heavy uninsurance. Here in Oklahoma, rates of 30 or 40% or higher in all these counties where there are for the individuals who are living at 138% of poverty or below. Okay, so and then you can see similar things in some of these other states. And so among the low income below this level of poverty, the uninsured rates are very high, even though the overall national average is around 2018 now, or 2017 back up to about 14 or 15%. In these counties, you can see 30% or more of the lower income working adults are uninsured. Now, the debates for politics and for the election, both at the federal and at the state level, often center around the issue of entitlements versus block grants. Remember that with an entitlement program, which Medicaid, traditional Medicaid is, everyone who is eligible for and enrolled in the program is legally entitled to receive the benefits. And beneficiaries may not be refused service for lack of funds or other reasons. This means that whatever the needs are of this program in the year, they must be funded by both the state and the federal government in their appropriate sharing according to these programs. Whereas block grants allocate a defined sum of money often from the federal government to the states, for a particular program over a period of time. And once this money is used, then beneficiaries may be refused service for lack of funds. And so there's no legal entitlement to receive benefits under block grants programs, even if you're eligible and enrolled. And this is a continuous debate between the Republicans who want to bring more programs as block grants for the purpose of containing the cost, controlling the cost, capping the cost, and the Democrats who are wanting to have these programs not as block grants but as entitlements so that everyone who is eligible will be covered in the aim of fairness and social justice. Now, this next couple slides reiterates Table 10.4 from your textbook, which showed the two plans that were put forward by the Republican-controlled Congress, both House and Senate, prior to the 2018 election. The House plan called the American Health Care Act and the Senate plan called the Better Care Reconciliation Act. And there are some key things here as with respect to their general campaign effort of repealing the Affordable Care Act. And there are similarities between these plans as well, but you will see here that the items that were attempted was to remove these tax credits in the case of the House. The Senate was keeping them. Eliminate the individual mandate penalties for sure by both plans. But here, the idea was to charge a 30% surcharge on the premium if individuals let their coverage lapse. That's actually a good policy step. If you leave your insurance lapse, then to reinstitute that, you have a surcharge to do that. That's at least still requiring some contribution of individuals who lapse their coverage, although this is key in terms of making sure that people can't move on and off of plans only when they want to undergo some service. The employer mandate was eliminated. Medicaid expansion was to be phased out on different time scales. Most key taxes are eliminated. States are allowed to submit waivers to redefine what benefits they would provide. More importantly, Medicaid was being changed to a block grant or a per capita allotment here, and states were allowed to require work requirements. With regard to women's health, there were several issues, defunding Planned Parenthood and various other aspects there. Notice with the private insurance market rules, two things were retained from the Affordable Care Act: dependent coverage up until age 26 and the provision that prevents denial due to pre-existing conditions. These were so popular with the American public that it was not feasible to roll these back. And President Trump quickly realized that and got on board supporting them. And then there were some additional elements here. The Congressional Budget Office estimated that the American Health Care Act plan would lead to 23 million more uninsured by 2026, 22 million by 2026 for the Senate bill, Better Care Reconciliation Act. And this was, these were estimated to achieve some savings. So again, here in the politics, we see that the efforts to essentially roll back and repeal almost all key provisions of the Affordable Care Act based on President Trump's campaign promise and supported by many of the Republicans, in the interest also then of savings. And here we have the debate, again, the tension between providing access and coverage to all Americans versus keeping some fiscal restraint in our spending here, as emphasized here by the potential savings. Now, subsequently, because those two plans did not pass, there was a merging of that plan, and as you know, the famous John McCain thumbs down vote in the Senate really was the death of that effort. And since that the Republican-controlled Congress was not able to pass a repealing of the Affordable Care Act. And then, of course, the House changed hands in the 2018 election. President Trump, at the beginning of this year, announced the Healthy Adult Opportunity Program as more steps to tweak and deal with the issue of changing elements in the Affordable Care Act. Again, you see the clear concept here of changing Medicaid to a block grant in order to cap the amount of money spent on that. And this was allowing the states to ask the Center for Medicare and Medicaid Services to change Medicaid, their Medicaid expansion to a block grant to cap their spending. This applied only to the expansion population for able-bodied individuals, and it excluded traditional Medicaid, the disabled and long-term care. And then it allowed great flexibility to the states to have work requirements, to implement premiums for these individuals, which seems a bit counterproductive if we're trying to provide healthcare to very low income individuals. We know that these type of things, premiums or the requirement for cost sharing, actually serve as a barrier to those individuals actually utilizing it. And there was an effort then to reduce the payments to physicians and other providers through these plans. I think that you will see these debates come back to the fore in the election coming up in the fall, once we get over the COVID, which is occupying all the news right now, and we'll get back to policy debates. And again, the crucial things will be, are we going to aim to cover all Americans universal access to healthcare or not? And how is this expansion going to happen? And is any additional new expansion of healthcare going to be under a block grant or an entitlement program? Now, you know, the Democratic candidates have debated the concept of Medicare for all versus Medicare for those who want it. This now probably will not be much more of a debate because it looks like Mr. Biden will be the candidate, and he's said he wants the approach of providing Medicare for anyone who wants to purchase that instead of what they have right now. That's a very reasonable approach. He's looking at the concept that it is unpopular to force many Americans, the majority of Americans who have health care through their employer, to give up their employer-based plan to buy a government plan. And so his approach is choice. Let individuals who may want to select a plan like Medicare, which may be cheaper than their employer-based insurance, then if they so choose, let them do that, but don't force people to give up their employer-based health care. Well, these debates are going to rage, as I say, through the 2020 election, and it will be very interesting to see where this elevates, and importantly, how the experiences with COVID-19 and individuals getting healthcare may shape the public opinion to this effort. Look forward to talking more with you about these things. Thank you very much.